Now we have series of lectures on energy-based devices, followed by panel discussion. And for that, I invite our experts, Dr. Ragini Agarwal Madam, Dr. Jamna Devi, and Dr. Yogita Gautam. Please come forward. I invite Dr. Amita Saxena to deliver her lecture on diode laser. Dr. Amita Saxena is a senior consultant, Marble City Hospital, Jabalpur. She is a director of Skin and Cosmetic Clinic. She is a founder of Jabalpur Cosmetic Society, and she is a past president of Jabalpur Obscani Society. Ma'am, you are welcome for a lecture.
I thank the Bhopal team for inviting us. Dr. Ranita, you have organized this workshop so well, and all the topics are so interesting. And I think we are going to sensitize and motivate a lot of doctors to become frag specialty doctors. So can we have the first?
After listening to two legends, once again, very good morning to all of you. At the outset, I must thank the organizer, especially Dr. Anita Srivastava Madam for giving me this opportunity. The topic allotted to me was vaginal rejuvenation with diode laser, evidence-based approach for menopausal women. As we all know, vaginal atrophy affects 50 to 70% of postmenopausal women in India, significantly impacting quality of life. Symptoms include vaginal dryness, dyspareunia, urinary symptoms, and reduced sexual dysfunction. It impacts intimate relationship and self-esteem, daily comfort and activities, and the condition is progressive. Despite, next slide. Despite being such good high prevalence, only 25% patients seek treatments, women who actually pursue interventional medical treatment. And there is 75% treatment gap, women suffering in silence due to the cultural barriers. This significant treatment gap highlights the urgent need for sensitive, accessible, and effective therapies options for Indian women experiencing menopausal symptoms. So actually, I want to share one experience. I belong to a family of dermatologists. I am playing with lasers for last 25 years. In 2021, one diode company came to us and for the demonstration, and I got 6-7 patients done with that machine, vaginal laser, and I got myself also done because I was also was in perimenopausal phase, and I got the laser done, and the result was wow. Me and my husband were very happy, and we decided कि चलो खरीद लेते हैं. तब तक लगता था patient आएंगे भी कि नहीं आएंगे, but चलो खरीद लेते हैं patient. And now me and my patients both are happy. So with this note, this is the machine. The diode laser is it's a laser, operates at wavelength of 980 or 1470 nanometer, providing controlled thermal energy to vaginal tissue. This advanced technology offers minimal invasive approach to treating vaginal atrophy. Mechanism of action, it works on selective photothermolysis, targets water in tissues for precise treatment. Diode laser induce controlled microthermal zones in vaginal mucosa, stimulating fibroblast activity and neocollagenesis. The photothermal effect triggers wound healing responses, increasing collagen type 1 and type 2. This process improves tissue elasticity and enhances vaginal wall thickness over a period of 3 to 6 months. There are few studies. RCT with 162 patients showed 85% improvement in vaginal health index at 12 weeks, significant reduction in vaginal pH, and improvement in epithelial integrity. Another systemic review of 14 studies shows demonstrates significant improvement in vaginal dryness, dyspareunia, and sexual function scores. This is an Indian multi-center trial which shows 70% satisfaction rate at 6 months and 45% female sexual function improvement index improvement, which is quite significant. This slide shows the comparison with CO2 laser. It is almost equally effective. Safety is better. It is patient comfort is very much, and it is very cost effective. So they are the key differences. Diode laser versus radio frequency also, if you compare, the time taken is less. It is the side effects are like patient is more comfortable and the patient satisfaction rate is more. So the selection criteria are ideal candidate are postmenopausal women with vaginal atrophy, breast cancer survivor usually who cannot take hormones, women seeking non-hormonal treatment options, and those with urinary incompetence and mild to moderate prolapse also. But I am not very happy with the prolapse patient. And naturally vaginal, those who want vaginal rejuvenation and vaginal tightening. Absolute contraindications are active vaginal bleeding, urogenital vaginal bleeding, infections, malignancies, and pregnancies. So the protocol is you have to rule out a proper parascapulum examination, pelvic examination, take pap smear, are the pre-treatment, and no anesthesia is required. Usually those who are very sensitive at enteritis, we put little bit of anesthetic cream, and then we put the patient on lying position, and we put the laser probe inside, and the laser works on 360-degree application. Post-treatment care is not much, only 3 to 5 days you avoid intercourse and you can immediately start your activity. Follow-up is usually advised 4 to 6 weeks, 3 sessions we advise. So this is the machine, the laser probe is inserted, the laser act on the vaginal wall through 360 degree. The action creates insignificant micro lesions with heat, only thermal heat. The laser targets the chromophores, which is water in my machine. This leads to production of the new collagen, which recognizes and re-equilibrates the components of the vaginal mucosa and the urogenital structure. Usually the thermal, with this my laser, it goes up to the photothermal effect, 0.5 mm below the vaginal mucosa surface, and collagen fibers get shortened, thicker, and as a result of the heat, induced collagen remodeling happens. In slide 2, you see the deeper tissue layer gets pulled up and tightened by the remodeled superficial tissue, and in third slide, the vaginal walls are further strengthened by the process of the neocollagenesis. So there is inflammation, proliferation, and maturation of collagen and fibroblast. In multi-center registry data, the adverse event is only mild to very mild, self-limiting for 4.2%. Patient satisfaction is 85%, and retreatment rate is 28%. Long-term follow-up outcome, if we see the extended follow-up data demonstrate the durability and safety of diode laser therapy for vaginal rejuvenation in Indian patients. At 5 months, peak symptom improvement and patient satisfaction. At 12 months, sustained benefit with 85% satisfaction rate. 18 months, some patient begins considering treatment, and 24 months, 76% maintain symptoms relief without interventions. Future direction in vaginal health technology may be with hybrid laser system, combination therapies, and AI-guided treatment. So the key takeaways are the evidence. There is evidence. It is evidence-based studies, multiple RCTs, and meta-analysis data demonstrate 76 to 88% improvement in vaginal atrophy symptoms with diode laser therapy. Superior safety profile, adverse event rate only 3.5%, cost-effective solutions, lower equipment and maintenance cost compared to CO2 lasers with faster treatment and time suitable for busy and Indian patients. The culturally appropriate, non-hormonal, minimally invasive approach that receive patients absolutely and addresses the significant treatment gap in India. Thank you.
Thank you, ma'am.